We've been in business for 75 years. The importance to us is that historical perspective of where we came from. We didn't build our company. Members of the community built our company. They saw the need to band together with their finances so that the few people who do get sick are covered by the many. And that philosophy is carried through. I believe that being in the communities is of critical importance. Going to the church or the Rotary or the cinema or having your kids in the Little League, we think that's extremely important. That's the reason we're spread out all across Kansas. And we're the only ones who do that. That may be why we've been successful in some of those rural communities. If you're a Blue Cross Blue Shield employee, believe me, the neighbor across the back fence is going to expect you to understand and know healthcare, and they're going to ask you questions. Our folks are very responsible, very ethical, very moral, and feel very responsible for our members. That's not something that just happens. The Blue Cross and Blue Shield brand is important because it's a national comfort. People are happy. They like the idea of having that, what we call the caring card, in their pocket. Initiatives in healthcare have always been a tenet of us, of Blue Cross and Blue Shield Kansas. More recently, we've been involved in an initiative called Pathways to Health. Being a healthcare insurance company takes some responsibility for people's health and educating them on what they need to do, how to do it. With 16 communities or counties in Kansas where we have invested in the county to have them help themselves through walking trails or initiatives about education for youth, doing contests for gardening, local gardening. Those are the kinds of things. A lot of rural Kansas doesn't even have a local grocery store. So having a local garden is a big deal. Well, okay, that sounds good. Well, who's going to come up with a plot? Who's going to tend it? Who's going to pay for the plants? So we're funding part of that because we know that comes back to us in improved health and lower cost. I think healthcare, looking beyond today and beyond the headlines, it's an exciting place to be. We believe in change here. We don't fear it. We've got to bend and mold ourselves to it. We'd rather do our mission to cover Kansans and improve the health of Kansans.